So let's get started.
Yes.
Let's get started. This is
So-
just one of those racy topics that, we really need to, every woman on the planet needs to understand this more than we do.
The topic that we're discussing today is osteoporosis, osteopenia, the prescription drugs that are prescribed for this condition, and what can be their side effects, and what can be done naturally to improve your bone density, your bone strength, and overall health.
So the most important thing is that we all know that our bones are strong, and they are one of those, everybody thinks that your bone is hard and nothing happens, but our bones are integral to our lives. That's where all our red blood cells are made.
Hi, Wendy. Yes, right. Our blood cells are made in the marrow. Our bones give us our strength it's kind of like our structure for movement and for protection. And we do have this idea that the once the bone is made, it's so strong that there's no change. And I was thinking about this. There's something we learn in medical school, and that is, and everyone's heard this, that the body, you have a new body essentially every 6 to 8 years. We say a new body every 7 years. And it's the bone cells that last the longest. So each bone cell will last, depending upon where it is, 5 to 7 years. The only thing, and why would we get osteoporosis? Because the body is only going to make new, better, improved, stronger bone cells if we change something.
Exactly. Because we change, and as we are naturally aging, from birth on, we're getting older, right? It's not
wiser.
That's not a secret. So here's a couple because, okay, so osteoporosis, osteopenia is a made up word by the medical community that isn't really a term. You either have osteoporosis or you don't, and they made this one up to get you onto the drugs earlier. And so we'll talk about that in a minute. But I just wanted to, so what the heck is going on, and why is this even? Aren't we designed? Really, we're fine-tuned machines. Aren't we designed
for our bones to be strong forever?
Sure, wouldn't you think so?
Well, do you want to talk about the hormones?
Well, I'm going to talk about the first one. I'm going to talk about is my favorite. It's malnutrition, and.
What is it that we say, that the saying about Americans, we are becoming overfed and undernourished. I think that's crazy.
And so hopefully everybody that listens to our YouTube lives and our Facebook lives and everything else, that you understand that D3, K2, and magnesium are essential. And because we're not going outside like our ancestors did,
to make the vitamin D3.
Exactly, and absorb it in your skin, and use the K2, which comes from grass-fed protein sources, which everyone is getting their meat at the grocery store, and it's not grass-fed anymore unless you're really emphasizing that.
And butter, if
it's organic.
And if they were actually in the sunshine.
Yeah.
Or egg yolks.
And then, of course, magnesium. What you just read something this morning, but 85% of the U.S. population is profoundly deficient in magnesium because it's not in our soil anymore. Yeah. So that's hence one of the big reasons why this osteoporosis and why we don't have the bone strength that we used to.
Because we have this idea that not only are our bones strong and there's no change, where we just explain that no, there's always a turnover. It's just a slower turnover. Hey, Kathy, it's just a slower turnover in bone than it is, say your red blood cells live for 3 months. Skin cells live, a few days. But bone cells can live 5 to 7 years. So the turnover is slower, but it still happens. And whether it's the malnutrition.
Let's talk about our other ones here, because we have a lot to cover. We want to get everybody on.
why would bone cells not be recovering, especially as women as we get older? So there's the malnutrition.
There's no malnutrition. Believe it or not, one of the big things is weight loss. You know, how many of us, right? I was never on the tab and popcorn diet, but every woman in America, well, I know a lot of women that tab and
Right.
popcorn was their diet.
Like we said, the undernourished.
Yes.
Yeah.
So then, of course, like the things that we know, cigarette smoking, excess alcohol, all of these things will pull these vital nutrients, the minerals from your system before the bones can get a hold of it.
Soda actually pulls minerals from the bone.
So, and this is a big asterisk because I did a lot of research and a lot of digging because I always want to say that, yeah, we never want to say anything that isn't a truth. But the carbonation that is in, you know, there's the first page on Google is always like, oh no, you can have all the LaCroix water you want and all this stuff. But when you start digging deeper, it's still a carbonated beverage and it still pulls.
And it's still made with phosphates.
Yes, and that will pull the calcium.
Apparently, the bones would prefer to have the phosphate than the calcium, and the magnesium. And all the other minerals that make up bone. So, yes.
So I was just telling Kim before we went on live, just to prove the point about the carbonation, I had an aunt. I wouldn't call her a dear old aunt because she was pretty eccentric. But Aunt Sis, in the old days, do you remember that the Cokes were those little baby bottles? And the reason they called them Coke was because they had Coke in them. They really did. And so Aunt Sis drank a 6-pack of those baby Cokes every day.
Every day?
Every day.
Oh
I am
goodness.
not kidding you.
Okay.
She was really small and she knit all the time. And I swear she could knit a scarf in a day. She'd be like, and, I mean, she
was
sweat.
coked up.
She was coked up, and she had always had sweat on her upper lip. I mean, she was like this big. She was this little, but she, she'd be knitting all the time. She worked really fast and everything else. Well, come to find out, Aunt Sis was all coked up and drinking this carbonated beverage. So one day, Aunt Sis went out to pull on her lawnmower, and seriously, she pulled on the lawnmower. It's not funny, but it was many years ago, and she pulled so hard that she actually snapped her back in half. And it wasn't until that point that they realized that
she had osteoporosis.
She had osteoporosis so bad that she literally didn't get up again. Her back healed, but then every time, it was at that point that every time she moved, like a rib would crack or something else would crack.
Poor thing.
I know,
Yeah.
I know, Ellen. Yeah, it was quite the story. But I did learn how to knit from Aunt Sis. They'd ship me off to Aunt Sis's house, but she didn't give me the Coke. That was really, I was impressed. Now that I think about it,
Wow.
I didn't get. She goes, no, you can't have this. So anyway, so that's the story of drinking pop and all these club sodas and everything that everybody thinks are just fine. I can't even tell you.
Now, I think Pellegrino is natural.
Yeah, it's
so
a natural, right?
I don't know.
Effervescence.
Yeah, I would have to.
So there's minerals in there and everything. So anyway, so that's the carbonation.
But that leads right into, the weight loss and the dieting and the malnutrition. The bones are living and they need that turnover. So, yes, there's, with the dieting and the weight loss, you have to have a certain amount of muscle mass because the muscles and the tendons attach to the bone, and it's their pull on the bone as we move and live our lives that actually sends messages to the bone, build more bone, build more bone cells. Hey, Deb, and so that is...
the causes.
That is... Yes.
Okay.
So more causes
So
for osteoporosis.
well, that's the biggies. Like, how does this happen? And it's basically a demineralization of the bones. But here's where the first one was the Fosamax, but now they've come out with this other one. What's it called?
Wait a minute.
Denosumab.
Wait a minute. You didn't talk about
Hormones.
hormones.
Of course.
That's a big one. Our audience.
I'm just all cranked up about that Fosamax and everything. Oh no, this isn't Fosamax.
As women know, the hormones start to decrease, and everyone seems to think that the hormones start to lower in your mid 40s, your 50s, going through menopause. However, the hormones start to lower in the 30s. And so that's why it's so important to actually be aware of what it takes to build strong bones. So we talked about the hormones.
Okay, so
I had to get that in.
All right,
because estrogen builds strong bones.
Exactly, and so, but that's another topic. That okay, do we need supplementation? We're outliving our bones on top of it, and our reproductive system, and everything else. So we are big proponents of natural hormone replacement.
Bioidentical.
Because otherwise you're just going to be, osteoporotic, cranky, hot flashes. And actually the estrogen, and don't forget the testosterone, we all need that. And that is our muscle strength. Again, going back to if you don't have enough muscle strength to pull against your bones, again, this is how we become aged and having brittle bones.
And frail.
Yes.
And even more afraid of moving because of that. So I know that's kind of another topic, but it does blend into this because before the prescription medications for osteoporosis were prevalent, the doctors knew that estrogen as a hormone helped women keep strong bones. So they were offering estrogen hormones.
And that took us down the other rabbit hole of cancers because they didn't know what they were doing.
They didn't know how much to give, and often they gave too much, and then there were breast cancers and heart diseases. So then they pulled back on that, and there probably could have been like a happy medium that would be more natural. That's why we're about bioidenticals.
Right.
So instead, there's this whole group of prescription meds, the
bisphosphonates.
And that is actually one of the top 3 medications that pharmaceuticals make.
So I have just this great visual. So what does this do? What does this med in particular do? Okay, so we have osteoclasts and osteoblasts.
Yes.
Now you would think that the bone would blast off the old stuff, but no, it's the exact opposite. So osteoblasts are new bone cells that are made, and they build. The osteoblasts build, and the osteoclasts are the dead bone cells, because remember, we're always replenishing our cells. Those are the ones that are sent off the bone, processed through the body, and boom, they're gone.
Removed. You have the shape of the bone. You're always going to have new bone cells being made, the osteoblasts.
Yes.
And when the osteoclasts, the dead ones, it's not quite this simple, but they're then supposed to be removed. Great, make room for more new ones.
So enters the biphosphonates, which hold the dead bone onto the bone.
If you even look up in
there's pictures
Wikipedia,
of it.
It says all these medications do. The only thing that they do
that's all they do.
Is stop the action of the osteoclast. They do not allow the dead bone to be removed, because in a DEXA scan, which only shows the amount of calcium in the bone,
So you understand that all it shows is the amount of calcium in a bone. It doesn't show
if it's
your other
alive,
minerals. It doesn't show if it's alive,
or
dead, nothing.
So as the medications prevent the dead bone from being removed, the body slowly fills up with more and more dead bone. So the studies will show that, for a while it looks really great. Okay, your scores are improving. We'll talk about that in a second. Your scores are improving. However, when it comes down to fracture rates and healing rates, the fracture rate is increased if they're on the medications, the prescriptions, and the healing rate is much slower.
So if any of you are on any of these medications, or you know someone that is, it says right in the warning, the little asterisk on that thing that everybody rips off that nobody looks at, it says, if you start experiencing jaw pain or loose teeth, you are to discontinue these medications immediately.
Right.
Why? Because the jaw is the most, how do I call it?
Vascularized,
has the most
has a lot.
vascular, has the most circulation in it. And so if it has the quickest amount of turnover. And so if these dead cells stay on there, your teeth start to come out.
Because there's more and more dead bone. So they call it that you have necrotic bone.
Jaw necrosis.
So at that point, that's when they're told, the doctor's told they can take you off of it.
Imagine.
After you've lost some teeth. Oh, there's another one that I was reading. It's not as common as the jaw necrosis, but still, if you've been on a medication for osteoporosis for over 3 to 5 years, there's a chance you can just have a spontaneous fracture of your femur.
And your femur is your long bone of your leg,
Between your hip and your knee,
which is the longest bone in the body, the strongest bone in the body. And can you imagine if you're 75 and you can't get up because your femur's been broken?
Yeah.
Because of this? So the other ones are injectables. There's one called denosumab, which is an injectable only once a month. Nothing, no problem with that. So again, they say, oh, it isn't the same, but yes, it is. So, these also can cause changes in kidney function, flu and fever-like symptoms, nausea,
muscle spasm and pain,
esophageal irritation.
right?
So these are really not the way to rebuild your bone. So let's talk about rebuilding your bone.
Since we've
Of
Of
scared
course,
you down.
we did say we would talk a little more about the DEXA scan and the DEXA scores.
Oh, that's right. That's right.
Because, we're, as women, we're encouraged to get your DEXA scan, and we're all about, knowledge is power. Sure, by all means, go and get that, and then use the tools that we're giving you today to make a change and to make your bones stronger. So when they do a DEXA scan, it's because it's X-ray, and they will have 2 scores. One is a T score and one is a Z score.
So a T score is comparing your bone density to that of a 30-year-old.
Now, when you're 60 or 70, how fair is that?
Not at all. So the number that you don't see, and I can tell you how many patients that I've had, and they come in and they're all upset and they say, I've got osteoporosis, my doctor said I've got to go on these medications, and they're all upset. I say, no, go back to your doctor and ask for your Z score, because that is the answer.
That is the answer.
Okay, what's the Z score? The Z score is?
The Z score is comparing your bone density with others of your age. So it's going to have you feeling better, and it's going to be a more normal representation.
I have known so many patients that have moved out of osteoporosis just by looking at the difference between the T score and the Z score. So again, this is all a big, I hate to say, it's all a big plot to get you on these medications.
Well,
it is. It's a scare tactic.
We sometimes will say that there will probably not be a cure for cancer because it's such a big.
Oh, are you going down that rabbit hole? Let's not go
okay.
there.
I would
Let's
say
not.
that the research behind actually helping the osteoblasts that build the bone, that's where we want to do more research instead of thinking that the medications that slow down the removal of the dead bone, that's not
Yeah.
where we want to focus.
So we're coming up on our half-hour mark, but we want the ways to improve.
Yes.
Statistics are incredibly, like the positive effects of weight training and strength training. You guys, even if it's like you're doing this and it's like your cans of coconut milk and you're just lifting those up, the amount of improvement so quickly with weight training,
Yeah.
it's phenomenal.
And if you haven't picked up weights in a while, start with the stretch bands, the therapeutic bands. Start with 2-pound weights and then move. And of course the weight bearing, the walking, dancing, even biking.
And did you know that there is more calcium in 1 cup of broccoli than there is in calcium supplements, and your body knows what to do with it. So
Yeah.
eating more calcium-rich vegetables,
Which is all the dark greens.
Yep. So that, along with, let's say it, D3, K2, and magnesium, there shouldn't be a person watching that doesn't know their numbers and taking them regularly.
Oh yeah, yoga is great.
Yep.
For bone health because it's weight bearing and you're really using those core muscles to pull on the bones. So that's awesome. Thank you for bringing up yoga as well as Pilates are great. Swimming not as much, but you're still using those muscles, and any movement using the muscles, that's going to affect the bones in a very positive way. I was going
More protein. Please
well,
eat
I was
more.
just going to say, most of us, if you are eating well or having, vegetables, are going to get enough calcium. And so it's the magnesium and the vitamin D3 and K2 you want to supplement.
Exactly. So we have a couple, a really, really incredible man. He's actually called, his name is Kevin Ellis, and he is called the Bone Coach. And he has a program for us lay people, and it's called the Stronger Bone Solution. And he is committed to helping women and everyone become educated about their bones and to do this a different way, because our bones are not just calcium; they're strontium and they're
Boron and magnesium and phosphorus.
All these other really important minerals that no one talks about because they can't make a drug to put them back in your body.
And I was reading also that they said because we're taking all of these calcium supplements, because for the longest time, doctors would say, you want to do it naturally, just take a bunch of calcium. But it wasn't in a form, without the vitamin D3 and K2 and magnesium was not being sent to the bones. It was actually causing the hardening of arteries and the calcification of heart valves. And so it's been associated with the increase in heart disease for women, and that's already the #1 killer. So
there's actually it's termed a couple of different ways, but they call it the calcium lie. There's 2 different books. One's called The Calcium Lie, and then the really
That's
creative,
easy.
right? And the other one is called The Calcium Lie 2. And so what the premise of the book is that doctors still do not know that calcium is not the answer, and there's a reason that cardiovascular disease is the number one killer of women. And why do you think that is? Because everybody's been taking calcium for the last 40 years and calcifying the insides of our arteries and our heart valves. It causes kidney stones. It causes bone spurs. because it doesn't know where to go in the body, and we've been taking the wrong kinds.
Yeah. Turns out bones are boring. Calcium doesn't want to go there. So unless you've got the vitamin D3, the vitamin K2, and the magnesium, it is not going to, the calcium will not help your bones.
It is not happening. So,
I wanted to share the research that I found about essential oils and helping osteoporosis.
which is like you really have to think about that one. But it's no different though. You say, how is this oil going to get in here and make me stronger? But it's no different than how is that biphosphonate going to get in there? How is everything is absorbed in our system, and and if it's high enough quality, it's going to do something positive.
If it's in the bloodstream, it's going to make it to every cell.
It needs to. It should.
Yes.
Yeah.
So we were talking about the structure of bone, and there is a scaffolding inside of each bone, and it is we've talked about fascia before, but it's the 3D matrix or the fascia inside of bones. And it actually continues outward, but within the bone, collagen can help that, but they also discovered some essential oils that help improve the scaffolding or what holds the minerals.
How cool is that?
Place.
You put something
right. So
that smells good
excuse
on your
me
body.
for reading the list, but I will put this down. So frankincense, which we know calms the brain and helps the nervous system. 2 from Australia, both tea tree, sometimes called melaleuca, and eucalyptus. So I love that.
Love eucalyptus.
I know. Wintergreen, which has its own natural menthol, rosemary, and ylang ylang, which I guess is sometimes used in natural perfumes. But it strengthens the inside scaffolding or the fascia inside the bones and helps improve bone regeneration. So this is something that may naturally be seen more of in actually helping those osteoblasts build more bone cells. Now, when it came to the hard bone, or they call it the cortical bone, there were other essential oils, and these were just diluted and applied topically to the skin. Cinnamon. I thought that was interesting. Cinnamon is
a circulatory.
It improves circulation. So cinnamon, rosemary again, ginger, which is also like a circulation.
Hot oil.
And thyme. And thyme is been shown to show antiviral, microbial properties. So the fact that this could improve the bone properties of helping to reduce, to help build bone and increase density, I thought was very cool.
That's very exciting.
And then there was the lavender and eucalyptus was supposed to help reduce osteoarthritis. So just thought I'd throw that in. I'll put that list in the link below.
Sure. And if anybody wants, if anybody's interested in, you can always, again, shoot us an email. We take all emails and answer as best we can. And this will be up. We are working on our YouTube channel so that you can catch all of these again, or if you have friends.
Right, because they're only on Facebook Live for 30 days. So we want you to have a chance to share this with friends and family. And we love to continue the conversation, so be sure to, send us messages, reach out, and we are happy to show up every Monday.
And we'll see you again next Monday night. And we have no idea what we're going to talk about. Isn't that fun?
But if you have some ideas, reach out and we will respond.
Hey, let's talk about this. Maybe we will bring up collagen again, because it is so important. I was out of collagen for almost, I forgot to order my collagen, and my hair started to thin, my nails started to split, and I was like, oh, I have not been taking my collagen.
Right. So collagen is...
So even we, mere mortals, do forget to take our vitamins sometimes.
Yeah, collagen's great.
Yeah,
Now you know it's great for the bones too.
yeah.
So have a wonderful week, and we'll see you next Monday.
Okay, see you everybody. Invite your friends. The more people that know about this and we can tell, the better. Thank you all for coming and telling everyone.
And we will put in the link below the types of collagen we recommend.
I don't really know how to put that in the link below,
Oh,
but
okay.
you know, we'll put it somewhere. I know we'll make a separate post, and
Okay, there you go.
we'll do some recommendations, and we'll put that list of medications that suck the.
I will tell
Calcium
you
right
that
on.
that the main collagen in the scaffolding of the bones is type 1. So there are different types, about 12 different types of collagen, and it's type 1. So if there's a collagen that you're taking, you want to make sure that it's primarily type 1.
There you go. Okay, everybody. Thanks for being here, and we will see you next week.